When you are new to helping and supporting your aging parent, there is so much for you to learn. It is so confusing. So today we're going to talk about Medicare and Medicaid and what they can and cannot do to help your parent with their long-term care plan. Hi there, I'm Sophia. I make weekly videos to help adult children navigate all of the information, the resources, and the mindset strategies so that you can have a peaceful and purposeful aging parent care experience and not have any regrets. So there is so much confusion about two things when it comes to taking care of and helping your parents with their long-term plan. The first confusion is all about Medicare and Medicaid. And the second confusion is about what are the resources available to help with that long-term plan and which of these insurances covers what. So today I'm going to put these two things together and hopefully make it a little more clear for you so that you can help them. And the first thing that I want to say is, unfortunately, I recently went on some caregiver support groups and saw some just plain old wrong information being given to poor family caregivers who are asking for information and they're being given the wrong information. So it gave me the idea that I really needed to make this video to help you out. Some of the things that I heard were that Medicare definitely covers an in-home care program. And no, they don't. And another thing that I have seen multiple times is that Medi-Cal doesn't cover assisted living facilities. And that's wrong because sometimes, yes, they do. So let's clear it up. So before I jump in, I just wanted to really briefly cover the difference between Medicare and Medicaid. Okay, and if you need a more in-depth version of this information, I did make a crash course on Medicare versus Medicaid with just tons of information for you. So I will put a link to that and all the other videos that I'm going to mention. I'll put links in the description box below for you. So let me just start with a brief definition of Medicare and Medicaid. So Medicare is the program that we here in the United States get when we turn 65, as long as we have been working into the system and taking taxes out of our check for a certain number of quarters throughout our lifetime. The other way that you can get Medicare is if you have been disabled for 2 years or longer, then you may be able to get Medicare even if you're under 65 years old. So Medicare is an entitlement program. We worked into the system, the government has to give that to us. We are entitled to that benefit. The other program is Medicaid. First of all, Medicaid might not be called Medicaid in your state. Different states might call it something different. Where I live here in California, it's called Medi-Cal. So do a Google search if you're not sure what it is called in your state. What is Medicaid in my state? So Medicaid is the insurance program that is for persons who are low income, considered low income or at a certain poverty level. Both Medicare and Medicaid are insurance benefits. They are not monetary benefits. So I'm going to talk a little bit about nursing homes first because that's the first thing people think about when they think of long-term care. But as you're going to see, that's not the only thing that's included in long-term care. But as far as Medicare in a nursing home, what they will pay, and you are going to hear people say Medicare will cover 100 days. Well, that is not always true. Medicare will pay for 100 skilled days if the patient, your parent, meets the criteria. A skilled day means that your parent requires care of a licensed staff. If they require an RN, maybe for wound care, or they require a physical therapist, occupational therapist, respiratory therapist, those disciplines all require a license, and their intervention is considered skilled care. If your parent just can't take care of themselves, they're not really getting skilled care, but they need someone to bathe them and groom them and change them, and help them eat, then that is not necessarily considered skilled care. That's considered custodial care. Medicare does not cover custodial care at all in a nursing home. Medicare will only cover skilled care if your parent meets the criteria of 1, needing that licensed professional, and 2, that they are, especially with the physical therapy and occupational therapy, that they are advancing and getting better at a certain rate over time. Once your parent may plateau and is no longer showing improvement in that area, then they no longer meet criteria, and therefore, if only 20 days went by, that's all Medicare is going to cover, is the 20 days. So yes, Medicare does cover 100 days if your parent needs skilled care and is continuing to show progress for 100 straight days. On the other hand, Medicaid will cover some of the skilled care in a nursing home. They prefer not to, I'll tell you the truth about that. But the one big difference is that Medicaid will cover the custodial level of care, meaning your parent no longer has a skilled need or they have exhausted their 100 days, then Medicaid will pick up from that point. So your parent doesn't need to have skilled therapy or wound care or anything like that. Medicaid would pay for them to stay in a nursing home long term. Long term could be anything from 30 days, 90 days, a year, or several years. Medicaid will continue to pay that. So essentially, Medicare doesn't cover long-term care at all. Medicare covers short-term skilled care, even in the home. So I think this is where some people get confused. Medicare will pay for care in the home under the umbrella of home health. What that means is that your parent was in a hospital and got discharged home, or they were in a skilled nursing facility under skilled care and got discharged home, and they continue to meet criteria or have a skilled need, then Medicare will pay for a short-term skilled care in the home. That would be a nurse to come out and do an assessment, and then they would make referrals for physical therapy, occupational therapy, speech therapy, social work, or an aide, a home health aide, to come out for a very short amount of time, usually just a week or 2 weeks or 3 weeks. It's not an ongoing benefit. So sometimes you'll hear people say that, yeah, Medicare covers a caregiver in the home, but it's only an aide, like a bath aide, who's going to come out, help your parent with a bath, maybe get them changed, and then they're going to leave. They're not going to stay for several hours for several days a week. They're going to come once or maybe twice a week to help with a bath if it is deemed an unmet need. So when somebody says, yes, Medicare covers a caregiver in the home, I'm guessing that that's what they're referring to. But as far as what we normally think of a caregiver as coming and staying for an amount of time, Medicare does not cover that. So I do want to talk about Medicaid. Medicaid, in some cases, will cover home health and is very often, with the skilled care, an extremely limited benefit. You're going to get very few visits because of that insurance coverage. The only exception would be if your Medicaid is signed over to an HMO, then they may have the ability to provide a longer duration of services in the home. There are a lot of other things that are considered long-term care, and they're covered by Medicaid. Not Medicare, but Medicaid. One of those is an adult day healthcare facility or an adult day healthcare program. What that is, I hate to say it's like child care for a child, but it kind of is, where your parent would go every day to a program, stay there for several hours, and then come back home at night, where they are under the watchful eye of a medical team. There are caregivers who can help them with incontinence. There are nursing staff who can give your parent medications. They can have lunch. There's activities. There's also therapists there if your parent needs that. And this program is often covered by Medicaid, so double check in your state to see if that might be covered. I absolutely love adult day health care, and I know families really kind of have a barrier up against it. Maybe it's because of the name, but I think it just serves so many purposes. Not only can your parent get the care that they need while they're there, they are also getting the socialization with other people, other participants, and activities that is so good for their mental status, which affects their health and their mental well-being. Also, if your parent is going to an adult day healthcare center, it is a fabulous respite for you. And you know, we are always talking about the need for respite and self-care, but for some reason people are really resistant to this option. But I think that it's fabulous. Another program that's considered long-term care is a program called PACE. PACE is a program that your parent can sign up for if they have Medicaid, and it covers the medical and social things all under one roof. It covers the doctor and the medications and adult day health care and transportation, and it could cover other things as well. The whole goal of PACE programs are to keep the aging population out of nursing homes and keep them in the home as long as possible by providing comprehensive medical and social services. The one thing to know about PACE is it is not available in every state. I think around 30 or 32 states do have a PACE program, so double check to see if it's available in your state. Another long-term care program is in-home supportive services, or it might be called something different in your state. Where I live, IHSS, in-home supportive services, is a Medicaid program that is administered by each county for Medicaid recipients who need assistance taking care of themselves. In-home supportive service program will cover a caregiver to come into the home to help them for a few hours, depending on what your parent needs. It could be a few hours, once or twice a week, or essentially they are assessed and given a certain number of hours per month for a caregiver to come in. That caregiver can come in and help with shopping and cleaning the house, or bathing and dressing, grooming, helping them walk, do socialization, drive them around. And it is covered by the county through the Medicaid program. So that is also considered a long-term care program. Another long-term care program that might be available in your state is the Assisted Living Waiver Program for Medicaid recipients. This also, I don't think is in every state, but it is in most states. But the criteria is different, and the eligibility is different, and the waiting lists are probably different. So what this program is, it is a program where you have to apply separate to make sure that your parent meets the criteria. If they do meet the criteria of needing help with themselves and they're on Medicaid already, then Medicaid would pay for an assisted living for them. Not every assisted living will accept it, but a whole lot do. And essentially, your parent would have to sign over any income, with the exception of, I think it's around $50 or so for their incidentals. And then the rest of the income goes to the assisted living, and then Medi-Cal will pay the rest of the assisted living so your parent can get the care that they need. But essentially, everything is covered. Their rent and their utilities and their food, activities, everything is covered. And so they really don't need a whole lot of extra cash to buy things other than maybe toiletries. So there, yes, are a lot of things covered under long-term care if you have Medicaid. Unfortunately, Medicare doesn't cover long-term care nursing homes, adult day health care, in-home supportive services, or a caregiver in the home, or assisted livings. The very best scenario is if your parent has both Medicare and Medicaid. Then they would be called dual eligible. And just a quick note, if you are thinking that your parent just doesn't qualify for Medicaid, you might want to double think that, because they are allowed to own a home, they are allowed to own a car, and all of their household items. Your one parent can apply for Medicaid separate from their spouse, and their income can be separated out as long as they're applying for a long-term Medicaid. And if your parent is trying to make plans ahead of time, which hopefully they are, then there is time for them to go to a financial or legal professional to help them protect their assets, so that when the time comes in a few years down the road when they may want to apply for Medicaid, then those assets will not be counted and they will be able to qualify for long-term Medicaid. So if you would like a professional to help you with that Medicaid process, or talk through the options, or to see if your parent qualifies, I recommend that you do a search for resource planners, Medicaid consultants, or Medicaid planners in my area. You can also go to the website for the National Care Planning Council to get referrals for resources in your state. I will go ahead and put a link in the description box below. And if you'd like, I made a more in-depth video about how to qualify for Medicaid while being a homeowner, so I'll put a link to that below. So if your parent needs long-term care but doesn't have Medicaid in place, then unfortunately all of these options, the nursing home, assisted living, a caregiver in the home, and adult day health care, are all going to be private pay out of your pocket. So the very best scenario is if your parent had both Medicare and Medicaid. So I hope this video really helped clear things up about Medicaid and Medicare and long-term care planning and what the options are. I really encourage you to go check out the video about Medicare versus Medicaid. It's a crash course and everything that you need to know. It's really going to be helpful for you. If you have any comments, please go ahead and leave them below. I absolutely love to hear from you. And if this video was helpful, go ahead and give it a thumbs up. Don't forget to subscribe so you don't miss any new videos on everything senior related. I thank you so much for watching today. I will see you next time.